Well, don't be that impressed. None of that, including the awards, was for anything I ever did as a politician. But it's funny, I was just talking to Andrea Horvath a moment ago, and I often remark on how I tell people how I used to be a humanitarian, the work that I did overseas in war zones, with my wife, Sam Nutt, who's far more impressive than I am, those of you who know her. And, but as politicians, we really try, it's just a different venue, right? We try to be humanitarians, and we try to find those opportunities to make a difference in people's lives. And I think that's one of the, for me it was a difficult transition, but one of the refreshing aspects about going into politics at Queen's Park is when I look around the legislature, and includes individuals like Patrick Brown and Andrea Horvath and the 107 of us, I guess 106 right now, that it's refreshing knowing just how committed and compassionate my colleagues are each and every day working. And so you should have the confidence knowing, regardless of political affiliations, we're all working genuinely and equally as hard as we can to try to provide the supports that Ontarians need or count on or should expect, or we have the responsibility to provide. Those of you who have been to question period, it might not always seem quite that way, or that we're necessarily getting along. But I want to start by saying, thank you for the invitation. It's great to be here again with you. But before I go any further, I want to extend a heartfelt congratulations to Doris on celebrating, I think just last month, her 20th anniversary as CEO of the RNAO. And I know we... Putting up with you? It's all for all of us putting up with her, apparently. And we're all hoping we get to put up with her for another 20 years. And, but I never cease to be impressed by your outstanding advocacy. And I think, as was mentioned a few minutes ago as well, evidence-based, and you have such intent, but you come equipped with everything required to provide that compelling argument and to advocate effectively. And I know one of the issues that we're working together on and with RNAO, and I really appreciate this, it's an issue that's very close to my heart, is the issue of national pharmacare. And as I think you probably know, it's not easy. It's one I know that the RNAO feels very strongly about and has been pushing hard, and Doris included as well. And I've been doing my best as health minister in the national arena to continue to push it at that venue and at the national agenda as well. I have always thought of pharmacare being sort of the unfinished business of Medicare, which is enjoying its 50th birthday this year, in fact. In fact, it was Tommy Douglas and then Lester Pearson 50 years ago, but we have to give credit to Tommy Douglas, who really introduced Canada to the concept and the importance of Medicare, and it combined at that time and then subsequent nationally under Pearson, it was one of the, I think, best gifts that Canada could have ever received, and that hasn't changed over the course of time. But that work remains unfinished. So most recently at the federal, provincial, territorial table in Vancouver earlier this year, as part of my relentless pursuit for national pharmacare, and believing, particularly as a family doctor and a public health doctor, where I can't tell you the number of times that I've given a prescription to an individual or a family knowing full well that they won't fill that prescription because they have to choose between filling a prescription or putting food on the table or paying their rent. Or I'd go into that sample drawer that many of you are familiar with, I'm sure, and pull out something that you hope is close to what they were required to have some legitimate access to medicines. So in that January meeting in Vancouver, I succeeded, it was at my urging that we actually succeeded in setting up a federal, provincial, territorial working group on pharmacare. And that's particularly important because we're working with across the country and with the federal government on a new health accord, over the next number of months. Also, Ontario is the co-chair with Jane Philpott nationally of the federal, provincial, territorial process, which includes the work that we're doing on the health accord. So I'm hoping, maybe, you know, those of you who do know me, I'm an idealistic guy, but I'm hoping that on our 150th anniversary, our 150th birthday, what better birthday present than announcing the next steps towards realizing a national pharmacare program. And so I say that partly because I need your help, right? So the more voices that we have speaking about the importance of that. But that's a bit of an aside, because I'm here obviously to talk to you about nurses and nursing leadership across this province. And there's no question, it's evident that you're key partners, not just in the delivery of quality health care, but you're key partners as well in the planning and organization and delivery of the next generation of health care for all of us. And I want to thank you and commend you for the many, many contributions that you have and will be making, even to the many tables that you participate on, things like the Joint Provincial Nursing Committee, the Nurse Practitioners in Long-Term Care Homes Role Development Task Force, and many, many others. But I also want to most recently thank you for your contribution and that of RNAOs to the discussion paper that I released in December called Patients First, which looks at reforming our healthcare system, primary care, our CCACs, a stronger role for public health as well across the healthcare system. And those of you who had the chance to read it will understand and see, well, you'll see RNAO in it, quite frankly, because your white paper that you released a number of years ago, the ECHO paper, Enhancing Community Care for Ontarians, it really, to a large extent, provided us with the blueprint for when we needed to look at how to reform, particularly home and community care. The recommendations and advice that were provided in that, both not just for CCACs, but also for primary care and beyond. So thank you for that, and that's important work. And I know that that work will continue, mostly because I know that if it doesn't continue, Doris will be banging down the door to my office to make sure that we continue to make progress on that, and we hope to be able to introduce legislation shortly. So there are, I think, many, many examples where we have worked effectively together, and I'm not so naive to deny that there aren't many challenges out there as well. In our hospital system, the very real challenges that our hospital administrators and boards have faced over the last 4 years, where they've had no increase to their base funding. This year in the budget, we provided a 2.1% increase to the operational funding for hospitals. I think to state that as being long overdue is probably an accurate statement. But I recognize the challenges, and I recognize the hard work that nurses do in whatever environment that it might be, whether it's in our public health system or whether it's in our home care system or our long-term care system, our hospitals, and the list I know is lengthy, but we depend on you, and fortunately your organization is so vital and so strong that we hear from you as we need to, where those pressure points are, and not just the challenges, but also the opportunities where we can do better and where we have to do better. So I just want to touch on two things very, very briefly. I've probably already sort of overextended. I didn't plan that long introduction, by the way, in terms of the CV, but in our budget, and about a year ago, the government made a commitment on RN prescribing, you'll remember. We reconfirmed our plans in our recent budget to move forward with legislation to provide RNs with the authority to prescribe drugs, independent prescribing, and I never before understood how important one word might be. And I just recently received the report from our Health Professions Regulatory Advisory Council, and I look forward to quite rapidly moving that, sharing that with my cabinet colleagues and moving it forward so we can change the legislation that, in a way that, quite frankly, will allow for better access to care for Ontario patients. It's the right thing to do. So. And there's more change coming too, and I know with what we've called up until recently physician-assisted dying, but now it's the medical assistance in dying, that is opening up, I think, a whole other set of expectations and realities. And so rest assured that issues like nurse practitioner prescribing of controlled substances, we're looking at that as well to make sure that we're providing, again, it's having that patient-centered focus of making sure that we provide the supports and we provide the scope within the practice of nursing to enable you to provide that important work and support. So, and also other important areas, it was RNAO really that alerted us, and we need to catch up on issues like wound care, particularly for diabetics and offloading. And we've got committees that have been set up, and I want to give RNAO credit to really encouraging us and giving us the kick that we need to make sure that we keep up with the science and the evidence and do the right things for Ontario patients again. So maybe the last couple of things just to touch on extremely briefly is I've heard, well, I know this, being a healthcare practitioner myself as well. I know about the reality of post-traumatic stress disorder, including among those in the nursing profession. And I understand, I'm very understanding of the disappointment of many of you that wasn't included in the recent legislation that was passed. I've heard from RNAO, I've heard from others about how important that is. I want to support you, and I want to keep this conversation, specifically this conversation, going to do what we can and ensure that we are providing the right supports to our nurses who often work in very difficult circumstances and have to confront very difficult issues that we know can lead to PTSD. So, and then the last thing I want to touch on is, which may seem like a small one, but I think it's important as well, is the issue of death certificates. And today, as you know, registered nurses can't sign them. The benefits of you being able to do so are obvious. So we're doing something about that. As part of our overall palliative care strategy, we're moving forward with regulations that will allow RNs to sign medical certificates of death in the province of Ontario. And it's a change, I know, that's been a long time coming, but it's one that really, like probably all of the other ones, just simply makes sense. So I seem to be saying a lot of that in my remarks. So you'll be hearing more about that in the weeks to come. But just in closing, let me just close by once again thanking you for all that you do every single day on behalf of Ontarians. I was fortunate enough. I wish, my sister's an RN, right? So from a very, she's 5 or 6 years older than I am. So from a very, very early age, I was instilled with a certain set of values that I attribute to her. And then I went to McMaster Medical School, to give a plug to that it was one of the first that really, I think, understood the importance of team-based medicine, and that we all are equals, and that we all play an equally critical role in the well-being of Ontarians. And so I want to thank you for being that equal member of our team, of our healthcare team. It's been a privilege to be here tonight. I look forward to being here again next year. Thank you, everybody.